Good morning, everyone, and thank you so much for joining us for NAMI Maryland's 39th Annual Conference. My name is Alexis Brown, and I am a volunteer with NAMI Maryland. I will be your moderator for this session today. This workshop session is Accessing SSI, SSDI, Busting Myths Through the Maryland SOAR Program, presented by Caroline Bolas from LEVELheaded Incorporated, Caroline Mason from Maryland Disability Determination Services, and Tristan Roberts from Healthcare for the Homeless. You can read more about our amazing presenters, including their full bios and the digital conference program on the official conference website. In this workshop, you will learn how implementing principles can lead to increased numbers of SSI and SSDI applications. This session aims to debunk the many myths surrounding the benefit process and provide practical tools that can be used when applying for benefits. If this is not the workshop you meant to attend, please click the back button on your browser or click on the conference drop-down on the left-hand side of your screen and select Sessions from the menu to return to the full list of workshops we have available. We will be addressing questions at the end of this presentation. If you have any questions as the presentation continues, please post them in the social wall on the right-hand side of your screen. We will be reviewing a question as they come in, and if something in particular is unclear or needs to be expounded, we will ask our presenters after their presentation has concluded. If you have any comments, concerns, or technical issues, please post them to our social wall, and our technical assistant will address them accordingly. When posting on a social wall, please be aware that there is a 20 to 30-second delay between the presentation and the stream on Conference Tracker. When the workshop session closes, you will be prompted to fill out a brief survey. If you would like to receive CEUs for this workshop, you must complete the survey in order to qualify. I'd now like to welcome our presenters for today's workshop, Caroline Bolas, Caroline Mason, and Tristan Roberts. Thank you all so much for coming back and joining us again.
Thank you, and good morning to everyone joining us. We'll be discussing accessing SSI and SSDI, as well as a bit more about what the SOAR program does here in Maryland. Go to the next slide, please. So just a bit of information about the programs, both SSI and SSDI. SSI is known as Supplemental Security Income, and this provides income to individuals that are blind, disabled, aged, or of low income. And right now that amount is $794 per month. It will be going up to $841 in 2022. The insurance benefit that is connected to this program is Medicaid, and individuals can qualify for this program even if they have never worked, but there are strict limits on access and resources, which is capped at $2,000 for individuals. Next slide, please. So SSDI is Social Security Disability Insurance, and this is dependent on an individual's work history and how much they have paid into the Social Security Administration system. And Medicare is provided with this benefit after 2 years for most people. The average amount that individuals have received with SSDI is just over $1,200 a month, but of course this varies as it is based on an individual's work history. So both programs are administered by the Social Security Administration, and at SSA, they determine the non-medical eligibility, such as if someone is working, if they aren't working. It also looks at the income, the resources and assets for SSI. And they contract with the State Disability Determination Services, or DDS, who then looks at the medical evidence to make a determination on disability. So for individuals applying on their own outside of the SOAR program, about 30% of all applicants are typically approved on initial application. And appeals can take years. And so people who are potentially eligible for disability benefits do give up and won't appeal their case just because the process can take so long without that additional assistance. And there's a lack of knowledge about the disability determination process in general, or just about the ins and outs of the SSI or SSDI programs. And so this complexity of the process makes it hard for some individuals to complete these applications on their own. And of course, medical records do not address all functional impairments or why someone is unable to work. And so if we're just reviewing the medical records, we may not understand the true extent of a person's disability. And so that is a big part of the SOAR program in really highlighting those issues and the functional impairments for an individual and proving why they may be unable to work. And so some of the reasons why it's important for an individual to gain SSI or SSDI is, of course, it provides them with a monthly income, which can in turn provide them access to housing as well as health insurance. And with those, there is the ability to then prevent or end homelessness and also just promote overall recovery for people with disabilities. So I will pass it on to Caroline Mason, who will discuss more about the process at DDS and what they do when they are reviewing a claim.
Thank you. Good morning, everyone. I am Caroline Mason. I work for the state agency, Maryland Disability Determination Services, and we are the agency that makes the medical determination on the disability claims from Social Security. So I'm going to do a couple slides basically about what we do at our office when we are making the medical determination. Everything that we do at our agency is policy driven by Social Security. And I always talk about what I'm going to discuss today is kind of the path that we follow at our agency when we're making the disability determination. So the first thing that I want to talk about today is the definition of disability. There are three key factors, pardon me, in this definition that I want to talk through. The first part is the inability to engage in any substantial gainful activity. And right now, SGA in calendar year 2021 is $1,310. And when we talk about SGA, SGA is the amount of money an individual is earning by going to work. If they're working and they're under the threshold of $1,310 a month, they would be eligible to file based on that. However, the inability to engage in this so-called SGA is that the individual has to have a medically determinable physical or mental impairment. So in our office, what we're doing is we're gathering the medical evidence with regards to the claimant's conditions that they're alleging and looking for the medical conditions and identifying a diagnosis that we can use in response to what's going on with the individual. And then finally, duration is a really key factor. And there's a few components that the condition has to be expected to result in death, or it has lasted or is expected to last for a continuous period of 12 months, no less than 12 months. So just to recap, we're looking at the substantial gainful activity, which is SGA, which is $1,310 a month. We're looking at the medically determinable physical and mental impairment, which is limiting them from engaging in that dollar amount, and the durational requirements that are indicated. So if we can move on to the next slide, I'm going to talk about our sequential evaluation process. So I just discussed substantial gainful activity in the previous slide. And that is something that Social Security determines prior to sending a disability claim to our agency for medical review. So what Social Security does is they do all the medical eligibility requirements before the case comes to our office. However, the entire time that we're adjudicating the claim, we have to pay attention to SGA if it becomes an issue. So if prior to that 12-month duration, an individual goes above the threshold, at step one of sequential evaluation is the claimant engaging in SGA. Again, if they go above that 1310, we would say yes. We would look at all the factors going on in that claim. And at step one, we could make a non-medical determination and just return the case back to Social Security, indicating that this individual no longer meets the definition of disability because they're working above the SGA threshold. That is something that we're actively looking at if it comes up as an issue while we're adjudicating the claim. So the next step is is the impairment severe? So between getting the claim at the DDS from Social Security to where we're starting to look at impairment severity, a lot has happened. Some time has taken place, and we've actively reached out to claimants' individual sources, whether it's a treating physician, a social worker, a psychologist, a therapist, hospitalizations, different types of programs that they've been in, schools, and also reached out to the individual themselves to gather activities of daily living or other individuals that are familiar with the claimant and their symptoms. So we've gathered all that information, and that's when we start looking at impairment severity. And at step 2 of sequential evaluation, we're looking at how much their condition impacts them from a medical perspective, but we're also looking, is it impacting their function as well? And if we determine that, and I'm going to talk more about function as we move along in the presentation, but if we determine that the person does not have a severe impairment based on all the medical records that we've gathered, at step 2 of sequential evaluation, we would deny the disability claim, indicating that the impairment is not severe. So also at step 2, if we feel like the impairment is more than not severe, we would jump to step 3 of sequential evaluation and ask ourselves, does the impairment meet or equal the listings? I'm going to briefly touch on this because I'm going to actually walk through a specific mental health listing in a couple slides. So, but what I will say is, again, going back to this is Social Security driven by their policy. They have provided our agency with a listings area within our manual, and the listings are broken down by body system, and there's a whole listing area that specifically addresses mental health impairments. And it identifies very specific criteria that has to be met and has to be found in the medical records that we're gathering. And if we have that information at step 3, we could meet or equal the listing. That is the first time within the sequential evaluation process that we could find an individual disabled and meeting the criteria for Social Security. If we find that the person does not meet or equal the listings, we would jump to step 4 of sequential evaluation, asking ourselves, does the impairment preclude the ability to perform past relevant work? Pardon me. So when we talk about work and relevant work, we're looking at the 15-year work history that we send out to our claimants. I understand that it is a very cumbersome form to complete. Some individuals may not remember what they've done, and it is a stressor to them. And I point that out because it's really important in the sequential evaluation process that we have this information for when we are making the medical determination at step 4 and step 5. We look at past relevant work. So if an individual is identifying work, we're looking at the type of work that they've done and how long they did it. For it to be considered past relevant work, they have to have done it long enough to learn the job. And we follow different guides from Social Security policy to determine what specific jobs are and how long it takes to learn them. And how we determine what type of work they can do, we create what's called a residual functional capacity. We create that for physical impairments, where we look at how much somebody can, walk and stand and lift and carry and use their hands, crouch and crawl, all different types of things that you would need to do to from a physical aspect. We also look at a mental residual functional capacity. And with the mental residual functional capacity, we're looking at a person's ability to sustain, attend, concentrate, work independently, take initiative, all those different types of things. So we build these RFCs, as we call them, based on not only the medical information that we've received, but also the activities of daily living and any other supporting documentation. And we create this residual functional capacity. We look at the past relevant work, and if the individual is able to perform their past work based on the residual functional capacity, at step 4 of sequential evaluation, we would deny their disability claim. However, if we were unable to identify any work, or if the individual has never worked before, we would bypass step 4 of sequential evaluation and go to step 5 of sequential evaluation. And we would look at, does the impairment preclude the ability to perform other work? What we'd really delve into a few more important aspects of the individual themselves. When we go to step 5 of sequential evaluation, we're looking at how old the individual is. If they do have past work, even though they couldn't return to it, do they have transferable skills from that past work to take into another vocation? We look at their age, we look at their education, we look at their transferable skills. We also still look at this residual functional capacity that we've created and determine, is there other work in the national economy that they're able to return to? It is our job to identify at least 3 jobs that they can return to. If we are not able to identify 3 jobs that they could return to based on their RFC, then we would find them disabled at step 5 of sequential evaluation. We call that a medical vocational determination. It's a combination of their medical conditions and then their vocation that would allow them at step 5 of sequential evaluation. In addition to meeting the listing and the inability to perform past relevant work or other work, if the individual is not found disabled by that, if we have a way to, I guess it's a sustainability issue. When we look at work, we're looking at an individual's ability to work, not on a part-time basis. We're looking at 5 days a week, 8 hours a day, 40 hours a week. And the person has to be able to sustain that level of work. We would never say somebody could return to work on a part-time basis because that is not what we're looking at. So again, if somebody doesn't fall into meeting the listing or returning, past or other work, we could look at sustainability. And if there is documentation that they've attempted to return to work and could only handle it on a part-time basis, those types of things, we could build a justification for what we call a sustainability allowance. So let's move on and start talking about the mental impairment listings. And then I'm going to walk through meeting and equaling the listings and the very specific criteria. So this is just a snapshot of the specific listings that are in our, it's called SSA, we have SSA Blue Book. SSA Social Security has a great website. At the end of our presentation, there's links to a bunch of different resources, but there is a link to the specific listings for mental impairments. Today, I'm going to specifically talk through depressive and bipolar and related disorders listing and walk through that specific listing and how we come to the determination using that listing. But this is just a snapshot of the other mental impairments that we do look at. If an individual doesn't have a very specific condition that falls under any of these, we will look at the different signs and symptoms and the criteria and kind of find a place to put them within the listings. So let's go ahead and move on to the next slide. And I'm going to talk specifically about the criteria, and then I'm going to go through the listing. So the way the listing is broken down for mental health impairments specifically is we have 3 types of criteria. We don't have to have all 3 types of criteria met in every situation. However, we do have to have A criteria, which is the medical criteria that must be present in medical evidence, and B criteria. Those 2 go together. So when I say the medical criteria present in the evidence, so we are out there gathering this medical information. And as we're reviewing the records, we need to see the signs and the symptoms within the evidence. And that is the specific criteria that is needed to be identified for somebody to meet the criteria for our A criteria. The B part is the functional criteria, and I'm going to talk a little bit about function again. So I'm going to bypass that, and then Caroline is going to go into real specific details and examples of functional information and how it can be shared with us. But we do look at specific function criteria. It's assessed on a 5-point rating scale: none, mild, moderate, marked, and extreme. And again, if we have the A criteria, we have to have the B criteria. And if we have A and B together, as you'll see in a moment, we could find somebody meeting a listing. Another way to meet a listing is the C criteria, which is used to evaluate serious and persistent mental disorders that have continued treatment and despite continued treatment, there's no significant adjustment in their mental impairment. And that has to be over a 2-year time period. And again, I'm going to talk about that in a little more detail in a moment. So let's move on to the listing that we're going to talk about. So this is information. This is not the complete listing. It's just information which shows the specific A criteria for depressive, bipolar, and related disorders. So as you can see, it says depressive disorder is the one that I'm going to talk about for this example. And we have to have 5 or more of the following signs or symptoms to be able to meet the A criteria. If an individual only has 4, we wouldn't be able to satisfy the A criteria, and we'd have to move on to other options. But let's just say the individual had depressed mood, appetite, and sleep disturbance, decreased energy, as well as difficulty concentrating and suicidal ideation. If that information, we see that in the medical evidence, and we're able to substantiate that from the evidence that we have satisfied the A criteria of this specific listing for depressive, bipolar, and related disorders. So that's the first step of being able to meet the listing. So let's jump to the next slide and I'll talk through the B criteria. And these are the 4 areas of functional impairment. What I'm going to say off the bat here is these are very simple, basic examples that we look for. I mentioned the Social Security's website earlier, and the listings. Embedded in the listings is, I call it the preamble. A lot of information about, the evidence that we're gathering, how we make the medical determination, but it also talks a lot about the criteria we need for allowing individuals with mental health impairments. It has a really great section that does an overview of the B criteria and what we're looking for with regards to functional impairment. So these 4 highlighted areas, specifically understand, remember, or apply information, really just, how somebody retains information that they've been demonstrated or taught, and then how they go and use it, how they problem solve. Are they able to follow instructions? How well interacting with others? How well do they get along with others? When we're looking at an adult's ability to return to work, we're looking at how well they get along with individuals in authority positions, supervisors, colleagues. We look at their ability to concentrate, persist, or maintain pace. Are they able to complete tasks without having to come back for multiple redirections? Are they able to attend for long periods of time? Are they easily distracted? Do they need certain accommodations to be able to be successful? And then adapt or manage oneself. Overall, a person's ability to just really take care of themselves, set goals for themselves, follow through, how they react or respond to change are really important. But again, we've highlighted these 4 areas. There's a lot more information on these specific functional impairments on the website. For those of you that are interested, and Caroline's going to talk about this later, kind of helping someone or helping yourself or a family member or a client, it's a really good place to go to get more information just about the listings and specifically the functional information. So let's move on to the next slide. And I'm going to talk about the secret. Oh, can we go back to B? I'm sorry, I got distracted for a moment. So I would maybe get just a mild on concentrate, persist, or maintain pace. So as I mentioned before on the A criteria, we satisfied the 5 areas to be able to identified 5 symptoms or signs to satisfy the A criteria. So here in the B criteria, we mentioned the 5-point rating scale from none to extreme. If any one of these functional areas, the individual has extreme limitations, we would satisfy both the A criteria and the B criteria, and the individual would meet that specific depressive disorder listing. If they were not extreme in one area, but were marked in 2 of the 4 areas, again, we would satisfy the B criteria, and A being satisfied and B being satisfied, we would be able to meet that listing. So again, going back, if we didn't have all the criteria in A or we didn't satisfy marked or extremes in B, we wouldn't be able to meet the listing using the A and the B criteria. And that's where we would at our agency jump and look at the C criteria. So let's jump to the C criteria. And I apologize for not wrapping that up before moving ahead before. So as I mentioned before, when we're looking at the C criteria, we're looking at serious and persistent disorders. These are conditions that have had, these are individuals that have had regular treatment for their conditions for at least 2 years. And that despite this treatment, regular support, high structured settings, their signs and symptoms, there's really no adjustment whatsoever. They continue to have struggles with regard to their condition and difficulties adapting to their environment. So this is another way that we can identify someone to be found disabled under that specific depressive disorder listing where we don't have the A and the B criteria specifically. We might have some of it, but then when we jump to C, we look at how long. So duration with regard to mental health impairments is really important to our agency. We really like to look at longitudinal history because sometimes we may not have all the pieces of the puzzle, but we might see that there's been this consistent treatment and structure and support. And despite that, there's still significant problems that the individual is having with managing their mental health impairment. So that is a little bit of information about the listing. And I know I mentioned briefly the functional limitations, but I'm going to pass it over to Caroline, who is going to go into a lot more detail about function. Thank you.
Thanks, Caroline. So I'm the other Caroline. I'm Caroline Bolas, the Maryland SOAR State Lead, and I support SOAR through the Behavioral Health Administration across the whole state. I'm really pleased to be here today. I'm going to finish up around the functional information and then talk very briefly about SOAR initiative in case it's of use to anybody who is listening here today. So really, as Caroline was just illustrating, the functional information is just key in order to help somebody get approved for SSI or SSDI. The challenge can be, though, as Tristan mentioned, often medical records really don't talk about functional information. They are really not set up for that necessarily. And particularly now with more electronic records, more and more they are becoming, I would say, just in some cases, checkboxes. So we can see that A criteria, we can see the person is experiencing symptoms, but two people can have the same symptoms, but the impact on their functioning can be very different. And so one of the things that we can do if we are helping somebody apply for benefits is to really think about what information do we have in terms of those 4 functional areas. And so in addition to any provider information from family and friends can be incredibly helpful, as well as information from the applicant themselves. So we're really trying to draw out, how is it this person experiences certain activities? How does this link to the symptoms that they are experiencing? And so when we do a SOAR case, I'm going to talk about in a moment, information from the applicant and family and friends can really, really make a significant difference in what we can present. It's really helpful when we're thinking about this to think about the functioning in a whole range of situations. So it may be, for example, that when I'm at home, I feel okay. I can perhaps interact well with my family, with, maybe 1 or 2 friends. But if I go outside, it really, really is very difficult to have those interactions. So we'd want to distinguish between, situations I feel very supported in versus those that maybe I feel less so. And that comes to the whole thing about supports. Again, it may be that if I'm at home, I need support in order to do my chores. I can do them, but I might need reminders or prompts or someone just saying, hey, this needs to be done. Without that support, maybe I wouldn't feel able to do those activities at all. And so the more we can provide information that sort of shows this is on a day-to-day basis, how I am impacted by my symptoms, the more DS gets a true picture. And then lastly to say, in terms of mental health, we know that we can have good days and bad days. So maybe on a good day, actually, I'm functioning well. But on my bad days, I find it really, really hard to function in those 4 areas. Again, we need to sort of provide that information and really show those bad days really, really would impact my ability to work on a sustained basis, like Caroline touched on. Next slide. So here is just a very brief example of the type of information that can be really useful for DDS to consider. So here we have Miss Doe. She struggles with short-term memory. Now, if we just stop there, that really doesn't help DDS. It's just a statement, but there's no real evidence. There's no real examples. So instead, we talk about, for example, that she forgets names, dates and times. She's been provided with a calendar, and yet she still struggles. She still gets confused, even though on a number of occasions, her caseworkers have tried to show her how to use it to track the days. It talks about too, if she has an appointment and she's not sure when it is, she might call repeatedly just to check. And that she forgets simple directions, for example, how to take her medication, and she needs that support in order to take her medication daily. So you can see this would provide great information for the functional area around ability to remember and apply information. So the more that we can give those examples, the more it allows us to flesh out the medical records. And so that's really what we are doing through the SOAR program. So SOAR actually stands for SSI, SSDI, Outreach, Access and Recovery. And basically what it does, it really aims to increase access to those SSI and SSDI benefits for individuals who are homeless or at risk of homelessness and have that severe mental illness. It is a program that is sponsored by SAMHSA. It's national and it's in all 50 states and Washington, DC. But it does look different from state to state depending on how the program is implemented. But the real aim is to really serve those who are most vulnerable and would find it most difficult to navigate this very complex process on their own. Individuals who may not have family, friends, other people who can support them through that and really need a lot of support network to help them through that process. The focus, though, is very much on seeing benefits as an aid to recovery, not as an end in itself. As Tristan talked about, getting benefits can really help with a whole range of services, can help with housing, getting health insurance, just a whole range, getting supported employment. It's a really important safety net. And so when we are working with individuals, we really stress that, you know, this is going to be a part of your recovery journey. It is not the end goal at all. It's part of a much bigger process to really help people meet their life goals. Next slide. So how is SOAR different to perhaps a regular application? Well, in a regular application, possibly the person would, pre-COVID, they might just show up at Social Security. Now they might phone up or they might get an appointment if they qualify, but they basically would provide SSA with information. And that information is lengthy. Individuals have to know, as Caroline said, about past work history, about treatment, past and present. And sometimes if someone's doing it on their own, it can be really difficult to remember, like, where was I treated 5 years ago? I know when I think about my own situation, I know I was seen by a doctor, but I would have to say I could not remember the name of that doctor 5 years ago. I would have to go and check. And actually, I'm not always good at keeping paperwork, so maybe I don't have that information. So it can be really hard to actually give all the information that's needed. And then in a regular case, the person's given that information. That's pretty much it from their point of view. They will probably hear from SSA or DDS to get a bit more information, and then they'll wait and they'll wait, and then they'll have the outcome. With SOAR, we take a much, much more active role in the process. We really want to provide DDS with the most robust case that we can. And so what a SOAR trained case manager will do is they will talk to the applicant. They will really hear their story. They will learn how is it to experience the symptoms you are experiencing. On a good day, how does it feel? On a not so good day, how does it feel? In the past, what happened? How is it that you are in this situation today? And really try and get a holistic picture that medical records alone just cannot ever show. You know, a medical record is almost like a snapshot in time. On that day, this is what I said, this is what the doctor, whoever saw. But we know that we are so much more than our medical records. And so with SOAR, we really try and capture information, like we said, from the applicant, but also with their permission, maybe family and friends, other providers, anyone that really can help provide that robust picture that the applicant is happy for us to talk to. In addition to talking to those individuals and gathering information, we will also try and get all those medical records. And as Caroline said, you know, duration can be important. And if someone has perhaps been homeless, maybe they've moved around a while, they may have sort of gaps without medical records. And like I say, may struggle to remember where were they treated. And so what we do is we really try and, again, build that picture. So maybe I get a medical record that says, oh, this person was treated at St. Jude's. Oh, I can now get St. Jude's medical records. And in that one, it said, oh, they were treated at a different facility. I can get those records. So prior to submitting the case, we do a lot of detective work to really try and get as much information as we can to, again, be able to present that to DDS. With the information that we get, we produce something we call a medical summary report, or an MSR. But basically, this is really just a narrative that really provides all that information in one place. So again, you know, in medical records, it might be a bit here, a bit there, a bit of history here. It's hard to really get a sense of the whole. And so in the MSR, we really take what we learned from the records, from the individual, from those around them, and produce it into one document that really provides DDS with a concise information. And we particularly focus on that functional information that is often missing. So that really can give a much clearer picture. We try and get it signed by a relevant treatment provider, and that can make it medical evidence. So it can become a really powerful document to provide additional information that would be missing from just medical records alone. We really focus on the initial application. We try and get it right first time because we really want to avoid those appeals that Tristan talked about. Like she said, it can be a lengthy process. And during that time, if the person doesn't have any income, it can be really, really stressful. It's also very stressful just to have to keep telling your story and perhaps, you know, feeling like people aren't believing the experiences you are having. So we try and avoid that by not having to get into those lengthy appeals situation. We have it that only those who have been through official SOAR training can actually do applications under SOAR, and that hopefully ensures that we do have high quality applications that gives DDS what they need. And I think one of the reasons we've been successful in Maryland is because of our amazing partnership with DDS. How it works is because we are working with individuals who are incredibly vulnerable, our cases can be triaged. So once they get to DDS, they can be triaged to examiners who undertake the SOAR cases, so they can start working on those cases immediately. And because we've done all that pre-work, we've collected all those medical records and got the information together, we can submit it to the examiners straight away. So in a regular case, DDS would get the application and then they would have to send out for all those medical records. And again, particularly during this pandemic, it's been hard sometimes to get those records. And so there can be a delay from DDS requesting the records to the provider being able to send them to DDS. By being able to give them right up front, then this allows cases to be adjudicated in a timely manner. And again, it decreases some of those processing times. We do keep an eye on what's going on, so we track our approval rates and our processing times so that if there is an issue, we can deal with it quickly. It is a complex process, and even with training and support, support, we get it wrong. And so we work very closely with our partners, SSA and DDS, to monitor and make good if things aren't working as well as they might do. And then lastly, we're going to talk about this in the next slide, or soon. We also have some funded positions who can actually take referrals to undertake SOAR cases. So going to start with that one. We're fortunate that in some of our jurisdictions, we have full-time SOAR case managers whose role is to do SOAR cases for anyone in the community who would qualify. And at the moment, we have SOAR case managers in Baltimore City, in Anne Arundel, in Baltimore, Frederick, Montgomery, Prince George's counties. The Frederick also covers Washington County, and we also have an individual who covers Mid-Shores, and we have a new position in Southern Maryland who covers Calvert, Charles, and St. Mary's counties. For those counties, we don't have a funded position. There are SOAR trained providers. We have SOAR trained providers in all our counties and Baltimore City. However, usually in that situation, they can only take claims if the individual is currently engaged in services in their agency. We are desperately always trying to increase the number of SOAR case managers, and so that's something that we continue to expand. We also have SOAR specialists in our state hospitals who undertake claims for people who are in our state hospitals. Every SOAR jurisdiction has a local lead, and they coordinate it for their county or jurisdiction. They will work with DDS, they will help troubleshoot any issues and really oversee it on that local level. And then through the Behavioural Health Administration, we provide support and ongoing technical assistance to really try and help people get the services they need. Next slide. So I just briefly want to share a bit about the SOAR outcomes. Since we've been collecting data, we have had over 2,000 SOAR applications adjudicated. We have an overall rate of approval rate of 83%. That's for both initial and for appeals. When we're just looking at the initial SOAR claims, we have an average approval rate of 86%. So when we compare that to the 30% that Tristan talked about, and even in fact, if we look at the approval rate for our population, individuals who are homeless and have a severe mental illness, that approval rate is more like 10 to 15%. So you can see that the 86% is a lot higher than either that 30 or that 10 to 15. And in fact, we have the third highest approval rate in the country, which we are very pleased and proud of because of the work of our amazing SOAR community. When people hear that, they sometimes say, oh, you know, this must be a different population. It really isn't. Many applicants, if not most, have previously had claims denied prior to being involved in the SOAR initiative. And often when they have been denied, often they haven't even had their cases get as far as DDS. So the medical determination hasn't happened because maybe they put an application in, SSA asked for more information, but they sent them a letter. The individual had moved, never got that letter, didn't know who to contact, or maybe they had to provide more information, weren't sure how to, and so it didn't happen. And so often they have what they call technical denials. So claims are really not looked at as they could be because the individual isn't able to navigate that process. And then in other examples, again, it's just not giving DDS all the information. And so it's hard for them to make a true determination when in fact, maybe records haven't been found, they're not really known when that treatment took place. So definitely we work with individuals who have tried often to navigate the system, and with SOAR, we can give them that extra support that allows them to do so successfully. Next slide. So if you are interested in SOAR, maybe yourself, or you want to make a referral for you know, family or a friend, here's our basic SOAR criteria. First of all, they have to be an adult in SSA's world, and that is 18 or older. So at the moment, we are not doing SOAR for children, but if someone is 18 or older, they can qualify. They have to be homeless or at risk of homelessness. And I will say we have a much broader definition than perhaps some programs you might be familiar with. So homeless would be, as you might expect, maybe someone living on the streets or in a shelter, a place unfit for human habitation. But the risk of homelessness can be pretty broad. If an individual isn't able to maintain housing without support, they're potentially at risk of homelessness. And we definitely don't want to wait until somebody is literally homeless before we can help them. So that part we always look at case by case, and often, we do find that yes, there is a risk of homelessness in this situation. So again, this is something that the SOAR specialist or the SOAR case manager would look at to see, do they qualify under that part of the definition. They do have to have a severe mental health issue, and that has to prevent them working above that SGA. So again, as Caroline said, people can be working part-time. As long as they're working below SGA, they potentially could qualify. But if someone is able to work then above that SGA, then they would not qualify. And again, it has to be because that mental health component that is impacting their ability to work on that sustained basis. Generally, they can't have a SSI or SSDI case already pending at the hearing level. So here with SOAR, we will take those initial claims, and then if they get denied, they have what they call a reconsideration. And really that is DDS relooks at the case. We can support people at both those levels. If they get denied again, they get denied at the reconsideration level, it then goes in front of a law judge and they have a hearing. At this point, we always recommend the individual does have an attorney. It's a much more legal process, and we really don't have the skills or the expertise to represent somebody at that level. So that's, if someone is already pending at the hearing level, we would not really be able to help them through SOAR. And then lastly, and obviously, the applicant must consent to work with a SOAR training provider. Not everybody necessarily wants to apply for benefits at a certain time, or maybe they want to do it through another agency or on their own. So again, they have to be willing to work with us if they do and meet the criteria. That's when we can work with them. Next slide. So as Caroline said, these are just a few resources. So the SSA website is a really, really great resource. It's very clear, and it has a lot of spotlight. So for example, Tristan talked about resources, assets and resources for SSI. There's a lot of information there about what counts as an asset or a resource. So we'll talk about countable ones and ones they don't count. For example, they don't count the house you live in or the car that you drive. So SSA provides a lot of great information about both SSI and SSDI on their website. And it's pretty good and easy to navigate. So we definitely recommend. As Caroline said, you can find the blue book, the listings there. You can also use this link, or as I always do, just Google SSA Blue Book, and it will take you straight there. If you just put Blue Book, you normally get Kelly's Blue Book, which is not what you want in this particular situation. But that will give you all that information that Caroline talked about. And it's incredibly helpful, because then you can really see, this is what SSA is looking for. How can I gather evidence that show that I do meet or equal those listings? There's also the SOAR National TA Centre. Again, this is another amazing resource. You can do the SOAR training if you wish to. It is a free course. It's all online. You can self-paced. You can do it at your own pace, however works for you. However, if you choose not to, which a lot of people obviously don't need to do that in depth, they have an amazing amount of resources. They have webinars you can watch that have been pre-recorded. They have articles. They have sample forms. So if maybe you're helping someone, or you're trying to fill out the form yourself and you're not sure what this question means, they can explain what the question means, and they can also give you a sample. So that is a great resource. It's open access to anybody who wants to use it. And then the last link we have is the Office SSA office locator. Basically, this just allows you to find out who your local field office is. You can put your zip code in and it will then show you your local field office. Sometimes you may only have one in your county, but certainly in some of our larger counties, you can have multiple, and it can be hard to know which is my local one. It doesn't always, it's not always intuitive. So putting your zip code in allows you to know which one to choose. Next slide. And then here is our contact information. We have got some time for questions. However, when we are taking questions, often the devil is in the detail if it's about a specific case. So if you are concerned about a case that you have been involved with, you want to get more information, and it's one of those where we can't give a general answer, we really want you to feel able to contact us. So as I said, I'm Caroline Bolas. Feel free to either call or email me. We can set up a time to talk if that's helpful. And then Tristan oversees Baltimore City. So anybody in the city, you can contact her directly. And then here's Caroline's information as well. So we really want you to feel able to contact us after the conference if we aren't able to answer any questions today. But we'd just like to thank you for the time, for being with us this morning. I know it's a lot of information. It's very confusing, complex programs, but we're happy to take any questions if anyone has any.
Well, thank you so much for that information. It was great. There is a question. If a person is receiving SSDI and has an unsubstantial period of work where they received quite a bit of money during 1 year, they've been on SSDI for over 10 years, how would that impact their SSDI?
So they're receiving SSDI, which is Social Security Disability Insurance, and they have 1 year of work?
No, they have over 10 years of SSDI, but they have 1 year of work where they gained a substantial amount of income during that period.
So that's, I don't want to say that's a difficult question to answer, but if it's there are what's called trial work periods, and that's another whole probably presentation on its own, but individuals can work and earn money during trial work periods, and it's unlimited, but it's 5 months, 9 months, 9-month trial work period. Caroline Bolas, jump in if I'm incorrect.
You're right, it's 9 months.
It's 9 months. So if somebody is working continuously for 12 straight months, there could be an issue with then their benefits pausing and then possibly restarting. But if it continues, their benefits could completely stop. So the most important thing here is if somebody does go back to work is reporting your work earnings and tracking it. There are some individuals that might do seasonal type of jobs and they might go back to work, you know, over a holiday or sometimes in the summer and just work a couple months, and they would be able to continue to get their benefits. Let's just say they worked 2 months, then that would be 2 months of the trial work period. And then if the next year they did another 2 months, that would be 2 months more into their trial. So it's complex. The most important thing is to report your earnings to SSA, because you don't want to be working too much and then get in an overpayment issue where
Okay.
the repay back to Social Security. So again, if this is a specific situation, I would encourage you to reach out to myself or Caroline, and we can help you with that.
Yeah, and I would just add to that in that it's very much, again, very case specific, as Caroline said. One great resource is the Red Book. So just as we have a blue book, they also have what they call the Red Book. And that details all the work incentives. And it's a really helpful resource because there's not even like a set figure how much someone could potentially earn because of the various work incentives. They have, for example, employment related work expenses, and they can reduce the accountable income that someone has. And again, this is all very, very complex. So my advice always is to seek a qualified benefits counsellor. These are free. If you contact SSA, they can provide you information about local providers. But basically a qualified benefit counsellor will sit down with you as an individual and look very specifically at your situation and just see, okay, what is countable? There's a whole lot of other things. If you're getting a job coach, that can impact. There's just so many. And as Caroline said, it's another whole day in itself, never mind just an hour, but definitely there's a lot of support out there. So that's always my advice, is the Red Book's a great starting point, but then contact a qualified benefits counsellor who will look at your situation specifically and let you know where you are in that process and how perhaps they will count your income, because it does vary a lot from person to person.
It really makes sense how that could be case by case, depending on where they are and how much money they're receiving over a period of time. So that's great information. I don't see any more questions. So what I'd like to do is just thank you all so much for this wonderful presentation. This was great information. And when this workshop session is closed, participants, you'll be prompted to fill out a brief survey. And if you would like to receive CEUs for this workshop, you must complete the survey in order to qualify. So again, thank you ladies very much, and I really appreciate it. And the next workshop session will begin at 11:20, so you have a little bit of a break. And just be sure to check out NAMI Land and other amazing virtual resources in our virtual exhibitor hall. And don't forget to participate in our resource scavenger hunt. If you fill out all the resources listed and submit your answers by the end of the conference, you'll be entered in a raffle to win a DSW messenger bag. So thank you all again for joining, and we hope you enjoy the rest of the conference. Thank you all again for this great information.